Your dog's ears may be saying something important long before your dog cries, hides, or refuses to let you touch them. A healthy ear is usually calm. No persistent scratching, no obvious swelling, no heavy discharge, and no strong, unpleasant odor. One quick head shake can happen after waking or playing. Repeated shaking, however, is a pattern worth noticing. The danger is not that every symptom means an emergency. It is that small changes can become painful when repeatedly ignored. A dog's ear canal bends inward rather than forming a straight open tube, which can make moisture and debris harder to escape. Long, floppy ears can also reduce airflow. For dachshunds, that makes regular observation especially useful after baths, swimming, or humid days. Water entering during a bath can leave the canal damp, especially when the outer ear is not carefully dried afterward. Swimming creates the same problem. The issue is not the fun itself, but moisture that remains trapped after the activity ends. Warmth, moisture, and poor ventilation create conditions in which normal microorganisms can multiply beyond a healthy balance. But cleaning too often can also cause trouble by disturbing the ear's natural environment or irritating already sensitive tissue. Products made for people, harsh antiseptics, and random home mixtures may sting, inflame tissue, or be unsafe if the eardrum is damaged. Cotton swabs should never be pushed into the canal. They can pack debris deeper and may injure delicate structures. Dust, loose hair, plant material, and tiny seeds can also become trapped, particularly after running through tall grass. Sometimes the ear is only where the problem appears. Environmental or food allergies can create inflammation that allows repeated infections to develop. Ear mites are another possible cause, especially when intense itching is paired with dark, waxy, or crust-like debris. Yeast and bacteria may multiply secondarily, but the underlying trigger still matters. Treating only the surface problem can invite recurrence. Odor is often the first clue an owner notices because a healthy ear normally should not produce a powerful, persistent smell. A mild natural scent can vary between dogs. What matters most is a new odor, a stronger odor, or odor with other symptoms. A sweet, musty, or fermented smell may occur with yeast overgrowth, but smell alone cannot confirm which organism is involved. A sharp, sour, or foul smell can occur with bacterial infection, yet different causes often overlap and produce similar odors. Dark brown or black material may be wax, yeast-related debris, or mites. Color is a clue, not a home diagnosis. Yellow-green discharge, pus, blood, severe pain, or a rapidly swollen ear deserves prompt veterinary attention rather than another round of cleaning. The same warning applies when odor, discharge, redness, and itching appear together. Multiple changes make evaluation more important, not more predictable. Constant scratching is not a personality quirk. It usually means the ear or surrounding skin is itchy, irritated, or painful. Frequent head shaking is another attempt to escape discomfort or move fluid and debris inside the canal. A persistent head tilt can signal deeper involvement and should be taken seriously, especially when it appears suddenly. Rubbing the ear against carpets, furniture, or the floor is another way dogs try to relieve pressure or itchiness. Redness and swelling show inflammation. Even when the dog still eats and plays, the ear may already be uncomfortable. Excess wax or new discharge matters most when it differs from your dog's normal appearance, amount, texture, or color. Pulling away, yelping, freezing, or guarding the head when touched can be a pain response. Do not force the examination. Loss of balance, circling, stumbling, unusual eye movement, or difficulty walking can indicate deeper ear involvement and needs urgent veterinary assessment. Violent scratching and shaking can even rupture small vessels in the ear flap, creating a painful balloon-like swelling called an oral hematoma. When ear problems keep returning, the real question is not only what is growing there, but why the ear stays vulnerable. A veterinarian may examine the canal and eardrum with an otoscope and study a sample under a microscope to identify the likely cause. Treatment may differ for yeast, bacteria, mites, foreign material, allergies, or a damaged eardrum. That is why guessing can delay recovery. Never reuse old eardrops from a previous episode. The new problem may have a different cause or require a different medication. Some cleaners or medications can cause harm if the eardrum is compromised, so painful or severely inflamed ears should be checked first. If the ear is red, swollen, painful, bleeding, or producing heavy discharge, skip home cleaning and call the veterinary team. For prevention, begin with a simple weekly look. You are checking for change, not searching deep inside the canal. Lift the ear flap gently and inspect only what is easily visible: skin color, swelling, debris, moisture, and discharge. Compare one ear with the other. A one-sided difference can make a new problem easier to recognize early. Notice any new smell from the outer ear without probing, inserting objects, or placing your face close to a painful dog. After a bath or swim, dry the ear flap and surrounding fur with a soft towel, using gentle pressure rather than rubbing hard. During bathing, keep the spray directed away from the ear opening and avoid forcing water into the canal. Use only a canine ear cleaner recommended for your dog, and follow the veterinarian's instructions for frequency and technique. For many dogs, routine care may involve wiping only the visible outer folds. Deeper cleaning should be done only as specifically instructed. Do not pour alcohol, hydrogen peroxide, vinegar, essential oils, or homemade remedies into the ear unless a veterinarian specifically directs you. Stop immediately if your dog shows pain, panic, or sudden resistance. A calm routine should never become a struggle. For dogs with recurring ear trouble, controlling allergies or skin disease may be as important as treating the infection itself. After walks through fields or dusty areas, check the outer ears for seeds, burrs, insects, or debris before they travel deeper. Floppy-eared dogs may need more frequent observation, but that does not mean they need aggressive or daily cleaning. Some healthy dogs rarely need ear cleaning. Others need a veterinarian-designed routine because of anatomy, swimming, allergies, or previous infections. The right schedule is individualized. More cleaning is not automatically better, and less cleaning is not automatically neglect. Early attention can prevent days of discomfort and may reduce the chance of inflammation becoming chronic, thickened, or difficult to treat. Chronic inflammation can narrow the canal and change the tissue, making future infections harder to manage and increasing the need for advanced treatment. Never punish a dog for scratching, shaking, or avoiding touch. Those actions are communication, not disobedience. Your dog cannot describe burning, pressure, or itchiness. The body speaks through repeated behavior, posture, smell, and visible change. Remember this simple rule: a new smell, a new appearance, or a new behavior deserves attention, especially when two appear together. Call your veterinarian promptly when symptoms persist, worsen, cause pain, or include pus, blood, swelling, head tilt, or balance changes. Bad odor, itching, and discharge are not just dirt. Notice early, act gently, and let your dog's ears tell you when help is needed.